Hello everyone, welcome back to my YouTube channel. It's one on one again with Juliet. Today we'll be talking about typhoid fever. Then we'll start with what is typhoid fever. Typhoid fever is an acute illness associated with fever caused by Salmonella enterical serotype typhi bacteria. It is also caused by Salmonella typhi, a related bacterium that usually caused a less severe illness. Salmonella itself, it's a bacteria that occur mainly in guts, especially a stereotype causing food poisoning. Now we'll talk about ways people contract this illness. Typhoid fever can be contracted by drinking or eating a contaminated food or water. Now we'll talk about how typhoid fever is being diagnosed. After the injection of contaminated food or water, the salmonella bacteria invade the small intestine and enter the bloodstream temporarily. The bacteria are carried by white blood cells in the liver, spleen, and bone marrow, where they multiply and re-enter the bloodstream. They develop symptoms including fever at the lymphatic tissue of the bowel. There they multiply. There the bacteria multiply in high number. The bacteria passes into the intestine tract and can be identified in stool sample. If a test result isn't clear from the stool sample, blood or urine sample will be taken to make another diagnosis. Okay, now we'll talk about the symptoms of typhoid. Things that happens to our body when the body is being contaminated or when the system becomes a carrier of typhoid. The incubation period is usually 1 to 2 weeks, and the duration of the illness is about 3 to 4 weeks. Symptoms include you could start having symptoms like poor appetite, headache, generalized ache and pain, fever as high as 104 degrees, lethargy, diarrhea. And let me mention again, chest pain congestion develop in many people, and abdominal pain and discomforts are also common. The fever becomes constant. The fever becomes constant. Improvements occur in the third and fourth week in those without complications. About 10% of people have recurrent symptoms after feeling better for 1 to 2 weeks. Relapses are actually more common in individuals treated with antibiotics. Like I said, I think I'll take that again. About 10% of people have recurrent symptoms after feeling better for 1 to 2 weeks. Relapses are uh, relapses are actually more common in individuals treated with antibiotics. As I will not fail to mention, when you start feeling or seeing any change in your body or your system, make sure you consult your doctor. That is why they are there for us. They are there to diagnose us. You can't carry out a self-diagnose, you can't carry out a self-medication. See your doctor for treatment and advice. Now let's talk about how typhoid is being treated. Typhoid fever is treated with antibiotics, which kills the Salmonella bacteria. Priority to the use of antibiotics. The fatality rate was up to 20%. Death occurs from overwhelming infection. Pulmonary intestinal bleeding or intestinal perforation with antibiotics as supportive care. Mortality has been reduced to 1 to 2% with appropriate antibiotics therapy. There is usually improvement within 1 to 2 days and recovering within 7 to 10 days. Several antibiotics are effective for treatment of typhoid fever. Chlorphenicol was the original drugs of choice for many years. Because of rare serious side effects, chlorphenicol has been replaced by other effective antibiotics. The choice of antibiotics is guided by identifying the geographical region where the infections was contracted. Certain strain from South America shows a significant resistance for some antibiotics. So now let's talk about typhoid fever at its glance. Typhoid fever is caused by Salmonella enterical serotype typhic bacteria. I will take that again. Typhoid fever is caused by Salmonella enterical serotype typhic bacteria. Typhoid fever is contacted by the injection of contaminated food or water. Diagnosis of typhoid fever is made when Salmonella bacteria are detected with stool, urine, or blood culture. Typhoid fever is treated with antibiotics. Typhoid fever symptoms are poor appetite, headache, generalized aches and pains, fever, lethargy. Approximately 3% to 5% of patients become carriers of bacteria after the acute illness. So today, I think we've been able to get one or two things about typhoid fever as a illness or as a bacteria. And if there is any question or where we're not clear about, please you can drop your comments, your questions in my comment space or box. Then I'll always get back to you. Thanks for your time. Thanks for watching, and I hope we all understand and know how to take care of ourselves to prevent contracting typhoid fever.